Hi guys, welcome to Session Reproductive Health Corner with Dr. Ifna Lilin. If you're new here, I raise awareness on issues concerning women and children. Just like I promised on my Facebook page that I am going to make this video on ectopic pregnancy, how to suspect you're having an ectopic pregnancy, things that can lead to ectopic pregnancy, and life after ectopic pregnancy. What is your chances of conceiving with one tube? So these are the things I'm going to address in this video, so please stay with me. Ectopic pregnancy, as the name implies, ectopic, outside. So it means that this pregnancy, fertilization has occurred, the sperm and the egg have met, and fertilization has occurred. A small, tiny baby, let's use the word baby for the sake of everyone, a small, tiny baby has been formed in you. But you know that where this fertilization occurred is not inside your womb, the round shaped womb. It happens somewhere along the tube. Do you understand? So after fertilization, this tiny baby is going to travel all the way from that part of the tube into the round part of the womb to attach to where it will now start to grow into a big baby. This is a kind of introduction to help you to understand. So, ectopic pregnancy happens when this fertilized baby failed to travel successfully into the main womb, into the main cavity of the womb to attach. In most cases, the fertilized egg, that tiny baby, will get arrested somewhere along the tube. 90% cases of ectopic pregnancy happens along the tube. So the tiny baby is coming, but because of one issue with the tube, maybe something has made the tube space to be very small, it couldn't pass through, or something has kinked the tube and it couldn't pass through, so it's going to get arrested there. And when it gets arrested there, it's going to keep growing like a normal baby, and then it can now grow the tube and ruptures. In other rare cases, the fertilized egg can implant in other part of the belly, the abdomen, or generally what lay people call stomach, your tummy. It's going to attach in any part of the tummy. I want to talk about the tubal ectopic pregnancy because that is the commonest one we see. So what causes ectopic pregnancy? What are the things that can lead to a woman having an ectopic pregnancy? One of them, which is the most commonest cause and what is mostly implicated, is PID, pelvic inflammatory disease. Pelvic inflammatory disease occurs when a woman is infected. A woman has contacted sexually transmitted infection and then left this infection untreated for over a long time. This infection is going to keep moving up from your vagina to the cervix into the womb and then spread to the tubes. And as they are moving, they are causing what we call swelling. We call it inflammation. Just like when something happens on your skin, it's going to get big and then it will now heal and go down. And sometimes it leaves a scar there. This is exactly what happens when this infection goes through your tube, straight to your tubes, they are going to cause that swelling, and when they heal, they are going to cause scar. If it is not well treated, it's going to cause a scar there. And the more scar it causes on the tube, the more it narrows the opening of the tube where the fertilized egg is supposed to pass. So imagine if one of the tubes was affected mostly, it's going to cause the narrowing. And if the egg that is going to be fertilized in a particular cycle comes from that particular side of the tube, when the egg is fertilized, it's going to find it difficult to transit from that tube to the inside of the womb, and the fertilized egg is going to get trapped there and cause what we call ectopic pregnancy. Things that can cause ectopic pregnancy include: 1, if you have had abdominal surgery before, you have had surgery done on your tummy before, like appendix surgery, fibroid surgery, removal of cysts, any abdominal surgery at all, is going to expose you to having an ectopic pregnancy, because when this surgery heals, it doesn't happen to everybody. This is just a risk. So when the healing process is going on, if the tube gets attached to the part of the tummy where you had the surgery during the healing phase, it's going to get attached to that place, and it can kink it, like bend it. And when you have a tube and you bend it like this, it's also going to narrow down and nothing will be able to pass through it. So that can also cause ectopic pregnancy. Other risk factors are people that smoke, cigarette, shisha. Those things increases your risk of getting ectopic pregnancy. Then women who are 35 years and above, these things are risk. I've already talked about the major issue, which is pelvic inflammatory diseases. All these other ones are risk that may or may not cause ectopic pregnancy. If you have had ectopic pregnancy before, it can recur again. So these are the risk factors. There are other ones, but these are the commonest ones. So how do you know that you have an ectopic pregnancy? First of all, you need to understand that ectopic pregnancy occurs in the first few weeks of pregnancy. So you might not even know that you are pregnant. In most cases, most women don't know that they are pregnant. Most women that come to the hospital with ectopic pregnancy are people that have not been even diagnosed with pregnancy. They have not gone for a test. They don't even know they were pregnant. Especially people that are not tracking their period properly. So they just show up in the hospital because they stay bleeding or spotting, and then all of a sudden they start feeling like they're about to faint, or they have this sharp pain on their tummy, and then they stay bleeding and they start having this faint. It's like, I'm about to faint, and before you know it, they are fainted. So if you are a woman of reproductive year and you are sexually active, please observe yourself. If for any reason you notice that you can't remember when you saw your period, and you are now having a vaginal bleed that is not similar to what you usually have in your normal period, or you start feeling like you want to faint, like, if nothing happens, I'm going to faint, please run to the hospital immediately, because you could be having an ectopic pregnancy. And if you know that you are pregnant, you have missed your period, and you have tested positive to pregnancy, and you know you are pregnant, and you start feeling these signs too, please rush to the hospital immediately, because ectopic pregnancy kills so fast. Before you blink, it can take a life. It is not something to joke with. It is not the kind of thing you say, don't worry, I'll be alright. I think it might be malaria, so don't worry. Let me take paracetamol, it's going to be fine. It is not something you joke with. Once you notice these things, the first thing you should do is to report to a hospital. I not say a health center. I did not say a maternity home. Report to a hospital where you know that you are going to see a gynecologist or at least a doctor that can perform a surgery immediately. This is not a time to start going to a primary center or a maternity home. So when you get to the hospital, your doctor, once you give this history that you missed your period or all of a sudden you stay feeling fainting attack and you are spotting, your doctor is going to ask you whether you are pregnant or you have had sex during so and so time, and you said they're going to do a pregnancy test for you immediately and an ultrasound to confirm what is happening. And if ectopic pregnancy is confirmed and it is actively bleeding ectopic pregnancy, you are likely going to move into the theater for an emergency surgery that may lead to taking out one of your tube that is affected. So what happens after ectopic pregnancy? The surgery has been done and the tube has been removed. And before you ask me, surgery is not the only method of treating ectopic pregnancy. There are other methods, but for the purpose of this video, I want to dwell on surgical treatment of an ectopic pregnancy that has ruptured. So after the surgery has been done, what is your fate? Because I see people most times, especially young people that are not married, they get pregnant and they had ectopic pregnancy. They keep asking you, what will I do? Am I going to get pregnant again? How do I tell? If I have a suitor, am I supposed to tell the person? And what is the person's reaction going to be like? This one that I removed one of the tubes, she might not be pregnant again. So, what is your fate after an ectopic pregnancy? The truth is that after removing one of your tubes due to ectopic pregnancy, your fertility chances is not the same with someone who has two tubes that are very patent. Someone with two eyes is better than someone with one eye. That is what I'm trying to say. But do people that have had ectopic pregnancy conceive? Yes, 100%. If the remaining tube is patent, healthy, and has no issue, a woman with one tube that is healthy, patent, with no issue, will comfortably have all the children she desires during her reproductive years. So one tube is enough as long as the eggs on that side and the tubes are reliable and patent and they are healthy. There is no reason why a woman wouldn't conceive with that tube if all other factors are met. So now I'll be able to clear you that a woman with one tube can achieve pregnancy if there is no other problem with her as a woman. You also know that ectopic pregnancy can occur in the other remaining tube if the tube is not patent or healthy. Ectopic pregnancy can reoccur on the remaining tube. And when this happens and it requires surgery to be taken out, the tube is also going to be taken out. And what is the fate of a woman like this? Of course, there are other options you can use to get pregnant. You have the widely accepted IVF and other method of artificial fertilization. And you also have option of surrogacy and adoption. You should be open to these things. The world has developed. They are not something to say culturally, socially. My family said, no, you should be able to have this discussion with your soon-to-be partner, and they should be open to this, because even people with two tubes might end up not getting pregnant, even when their tubes are patent, because of other issues, and are going to still resort to these other options. So you should be open to discussing it with your partner. So how do you prevent things that can lead to ectopic pregnancy? Since pelvic inflammatory disease is the major culprit in having an ectopic pregnancy, and it is caused by untreated sexually transmitted infection, the major thing to do is to avoid risky sexual behaviors: having an unprotected sex, having unprotected with people you just meet in a club, at the bar, like casual sex with people you don't know. You just hit them and they hit you, and you just have sex, no protection. You shouldn't do that. It's a high risk behavior. So if you want to engage in sexual intercourse, you should always be protected. If you have one partner who also takes you as their only partner, and both of you are healthy and safe, please stick to your partner. If you want to use condom, use it consistently. You don't use condom on Monday and do skin to skin on Friday. Don't trust anybody when it comes to sexually transmitted infection, except you are married to a partner who is also faithful and reliable. So what am I trying to say? To prevent sexually transmitted infection, practice safe sex by use of protection, female condoms, male condoms. Be faithful to a faithful partner. Use condom correctly and consistently. Don't trust anybody, especially if they are not your partner. If they are not faithful and you have a doubt, don't trust them. Use protection. When you notice that you have a sexual transmitted infection, maybe you have vaginal discharge, odors, itching, lower abdominal pain, please report yourself to a medical doctor. Don't go to the chemist. Don't go to any other place. Report yourself to a hospital so that you can get properly tested and treated. Some of you are fond of going to side labs to get a high vaginal swab done, HVS culture done, and the method of sample collection is not reliable, so they end up giving you an organism that is not even the one causing your infection, and you keep taking antibiotics over and over without achieving results. Please see a doctor and get treated properly, and get post-treatment screening to be sure that you are okay, so you don't come up with pelvic inflammatory disease later in life that can cause scarring of your tubes and lead to ectopic pregnancy. We have said that smoking is not healthy for a woman of reproductive years, so you can decide to stop smoking. Shisha, cigarette, they're all the same, so you should quit smoking. If you have an abdominal surgery, get it done in a very good hospitals and take your antibiotics as prescribed, and you can limit your chances of having a kink tube from adhesion from those surgeries. So if you had ectopic pregnancy before and you conceive again, you should be observant about the changes you are having in your body. You should go for your antenatal very early because you're having a very high risk pregnancy, and you should always visit your doctor and pay attention to your health until you pass the first trimester, where the chances of having any thing that has to do with ectopic pregnancy is limited. Thank you very much, and I hope you get value in this video. Please subscribe to my YouTube channel, share with your friends, like this video, ask questions in the comment section, and I'll be here to answer you. And please follow my social media handles to get updated when I have new products and services, and share my handle with your friends. Thank you very much, and see you next time. Bye.